And that's one of the things I want to talk about is for men. Like I know my dad, he's 60 years old now, but his last testosterone level was around 500. So when you see a 60-year-old man with completely, at least to me, 500 at that age is good. Do you still see a need to look into that for testosterone replacement therapy, or do you say, hey,
No,
if you're
no,
not
no.
symptomatic?
Let's make it very simple. I have two hats. I have a diagnosis hat and I have a management hat, right? It's got to start off with diagnosis.
Mm-hmm.
So when you diagnose a man with low testosterone, he comes in, you get labs, and then you do a history and a physical exam, correct?
Yep.
And you ask him it's called the chief complaint in
Mm-hmm.
the history of present illness. What's up, buddy? What's going on? How's your sex drive? How's your energy? It doesn't mean every man that has higher normal testosterone. It becomes complicated. So then you
Sure.
look at the level, and then in the endocrine society, I'm much more in their wheelhouse than I am anyone else's wheelhouse. I mean,
Mm-hmm.
these are endocrine. So the guideline for testosterone replacement from the gut that tells you the common sense and the ethical is you do a history, physical, you hear the man's complaint. It's going to have something to do with sex. If a guy
Yep.
has testosterone level from 250 to 300 to 700 or 1,000, and he has a sex drive, and he goes, "Whew, sex drive's great." He's
Yeah.
not getting testosterone from me. But on the flip side, if you have a man that has levels that are, say, around 250, 300, or in the mid 300s, and he has a poor sex drive, you have to reach into this and you have to figure out, and then you look at total versus free, right? So now it gets very complicated.
Right.
So your dad could have 500 normal, but this is the bro science. Again, not all the anti-aging stuff is not all useless. In part,
Mm-hmm.
that learned a lot. So endocrinology doctors, if you're diagnosing testosterone and you know what you're doing at least one sample in the morning. It's going to be a total and a free.
Mm-hmm.
It's going to be a liquid chromatography mass spectroscopy run by a dilution method. Did I just say all that? That was a lot to say. But I'm just showing off, but it's true. So you better do the right test, and you better just not do a total, because your dad, when men get older, that's not old. He better not be old, because I'm right behind him. So, and I'm trying to stay in great shape, trying to enjoy mountain biking and a great quality. Everything, my friend, is quality of life.
Sure. Yep.
You want to have the best quality of life for the longest life. Anti-aging, you better go see a good internist.
Mm-hmm.
Stay away from anti-aging doctors, so they're just going to sell you garbage. I may get punched for this, but I may get smashed from this, but that's just, I'm in bed. I'm in the camp of real physicians that are overworked, that are super great people, men and women. They're working in this country and other countries, and they're trying to help people, and they're trying to, there's a round peg in a square hole a lot of times because of the time, the money problems, the payment problem.
Right.
So back to the testosterone, you have to understand it's not just a number. If you, but do you have to be doc? They all say to me this is, I've seen thousands of patients. Doc,
Right.
the number low has to be 249. Doc, I'm 252.
Right. Right.
Go away, sir. So,
Right.
so the Endocrine Society has said you have to look at labs. You have to do the right labs, which is a total and a free, and the dilution method. It has to be that liquid chromatography. That means dilution method. It has to be
Mm-hmm.
reproducible. You really should do it once or twice. You don't need to, but you should. If a man realizes that the seriousness of going on this medicine is permanent and could really, have side effects, including cardiac and prostate, right?
Sure.
Hair
Right.
loss, gynecomastia, mood issues. I mean, not everyone on testosterone has great sex, by the way.
Right.
We're complicated creatures, pal. So when you look at that and you see that it's a clinical diagnosis, we use labs to support it. Obviously, if a man is 700 and his free is normal, and he's 28 or 38 or 48 and 58, he's not getting testosterone from me, but he's not coming to see me.
Right.
Most guys who come to see me are already on testosterone. The diagnosis has been made. They're on long enough. Hopefully it was a proper diagnosis. But again, sometimes it might have been a weak diagnosis, but regardless, they're on testosterone now for a year, 5 years, 10 years, and their red blood cells are elevated, right? This is complicated. Their HDL is low. Maybe they had a heart attack or a stent placed. Maybe their prostate's enlarged. And now they come to me, which I'm very humble, and because this is my day job, and
Mm-hmm.
I pick up the management, and I work again with other physicians, including primary care, urology, endocrinology, cardiology, hopefully not nephrology, because hopefully the kidneys are not damaged.
Right.
And that's more the steroid level guys. You know, when they're doing excessive physiologic doses and they're getting really beat, horrible. They're getting really hurt really bad. But testosterone dose dependently, the more you take, it's like booze. You do a little bit, probably okay.
Right.
You do a gallon of vodka, you're going to pay the piper.